dating during COVID has been interesting. It's made me be more thoughtful about who I choose to spend time with and what that time looks like. It's made the idea of quality time take on a very new and different look and feel. It's made me be more creative about what that time looks like. And I've actually had some of the best dates that I've ever had since I've started dating.
Well, I think one of the biggest ways that COVID has affected dating for me is I'm an intensely kinesthetic person, and touch and smell are really important to me. So not being able to hug someone and see how they smell, or for lack of a better term, what their energy feels like, to hug them, to touch them, has been really challenging, because if you get to that point, then you have to really make some sort of a commitment with that person.
I feel like COVID has affected my way of communication, which clearly then directly affected the relationships that I was in. And that was because I realized that I wasn't communicating as well as I could have been. There was no issues, but maybe I wasn't being clear on some of my preferences.
COVID hit, and I don't really know how you can date in a pandemic. Not at the stage of dating that I was at. I know a lot of people who actually had their relationships sort of fast forwarded, because, one thing that this has done is it's forced us all to get very clear and clarify what matters to us and what's important to us, I think. So, everybody's kind of had their little pods of people that, we all are trying to, keep our circles as small as they can be to be safe. And, when you're at the stage of dating where you're literally just going out to meet people, you can't really do that. So, I just haven't been dating at all, because I have kids and I don't know how you can do that responsibly. So
my husband and I had to completely change our wedding from a in-person wedding with our friends and family to a Zoom wedding at the last minute. And then as newlyweds, we have been trapped together since that wedding day in April, and it's crazy. I work from home now, he works from home now, and it's a whole lot of each other, which is good, but also challenging.
I'm currently working as a contact tracer, so I spend my whole day calling people talking about COVID safety. And so, yeah, I haven't met anybody yet, but I hope that as things start warming up, we'll at least have more of an opportunity to do safe, socially distanced, masked type activities, and hopefully get a good date out of it. But yeah, it's definitely been a struggle. It's already hard to date in Sacramento. You throw a pan Demi Lovato in there and it just gets really hard. But I'm staying optimistic.
What up, y'all? Back for another Monday night here at the illustrious ZFG headquarters, brought to you by our partners at Protect Us. And as per always, I'm Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spitting Quarantino, aka I wear my sunglasses at night, like the middle of the night, because my eyes are as sensitive as my heart is, y'all. And we have an incredible show for you tonight. It's Valentine's. It's the Valentine's Day edition. Hence why we were asking everybody how COVID has affected your dating life. So we have an incredible show for you tonight. We have the Dr. Fauci of baby making. We have the Michael Jordan of midwifery joining us tonight. We got loads of Joseph coming through tonight. Yeah, it's going to be a really exciting show. So, as per always, everything is going to be Valentine's related, love related this week. Even the Rona update, Even the weekly Rona update is going to be Valentine's Day related. And here's what I want to make a deal with y'all. I don't like doing the numbers and listing off a bunch of wild numbers that like hurt all of our hearts every week. So I'll make y'all a deal. If you keep the numbers trending down, then I'll stop reporting on them and I'll find good news around the pandemic Lovato. And we will report that. How about that? How's that feel to you guys? That works? All right. So that being said, let's get to it with the weekly Rona update. So this story comes to us from Daniel Victor at the New York Times. The coronavirus pandemic has been rough on virtually everyone. But those who have been single through the isolation, fear, and upheaval say they've been confronted with a distinct set of challenges. Some who said they were content with being single before the pandemic have nonetheless struggled with what they're missing in emotional support and even routine physical touch. The first few months I thought, this is okay. I can work on myself, said Gagan Bhatnagar, 35, a clinical oncology consultant in London. But then it just dragged on. One day I realized it had been 3 months since I had touched a human being. Being unable to date as usual has robbed people of the hope and excitement that can sustain them through typical rough patches, he said. And while people miss sex, there was more severe pining for non-sexual forms of touch, the day-to-day contact, couch cuddling and hugs, even high fives that have been severed off in an age of social distancing. Science supports the necessity of human touch. Tiffany Field, the director of the Touch Research Institute at the University of Miami, said research had shown touch was as crucial as a mood stabilizer. To have well-being, you need to have touch, she said. And if you don't have that, you go into these states of anxiety and depression. Even those who consider themselves fully self-reliant have felt the loss of chance meetings or the reduced possibility of an unexpected burst of excitement. All of the self-sustaining energy needs to be self-generated, one single explained. There's no one else there. There isn't anyone in the physical area to rely on emotionally, physically, or spiritually. Grace Rogers, a 24-year-old in Charleston, South Carolina, said friends in relationships sometimes told her that she was the lucky one without being cooped up with children and a partner. They imagined she would be free to read all of the books she wanted in peace, but she countered, at least they had people to talk to on a regular basis. It sucks for everybody, Ms. Rogers said. It sucks in different ways, but it sucks for everyone, and there is no need to minimize it. So are you one of those people who is at home with a partner and maybe the kids, or are you someone who is there alone? How y'all doing in the pandemic Lovato? All right, so let me know. You can always comment. Thanks to everybody who's already sharing this, everybody who's already jumping in the comment threads and in the chat. We are going to get on to our next subject, which is the latest health news. Oh, I triggered the wrong thing. Oh, production team, someone's getting fired around here. I said latest health news. So I want to talk about breaking down some stigmas on this episode, right? Getting checked for STIs, STDs, very, very crucial. And for everyone, you know what I mean? They're listen, let's just keep it real. There cannot be a stigma if 1 in 5 people have the same condition. You know what I'm saying? So this story comes to us from U.S. News and the CDC. The CDC reporting that 1 in 5 Americans has an STD. According to 2018 data, 1 in 5 people in the United States probably carries a sexually transmitted infection, the U.S. Centers for Disease Control and Prevention says. On any given day in 2018, nearly 68 million people had a sexually transmitted disease, according to the new CDC report. There were 26 million new cases that year. Nearly half of newly acquired STIs occurred in people aged 15 to 24, although we should say cases are up for older people as well, especially the senior citizens. And new cases in 2018 would result in nearly $16 billion with a B in direct medical costs, the report said. People with STIs don't always have symptoms. Left untreated, some STIs can increase the risk of HIV infection or cause chronic pelvic pain, pelvic inflammatory disease, infertility, and or severe pregnancy and newborn complications. This is lifelong damage we're talking about, y'all. And fellas, we need to listen close because it disproportionately affects women. Of the estimated $16 billion in lifetime medical costs from STIs acquired in 2018, most, that's $13.7 billion of that, were associated with HIV. Another $755 million were attributed to HPV infections. About 60% of those costs were among 15 to 24-year-olds. The total cost of STIs is far higher than the medical costs estimated. However, the study authors noted, the report didn't include costs associated with lost productivity, other non-medical expenses, or STI prevention. The burden of STIs is staggering, said Dr. Jonathan Merman, director of CDC's National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention. At a time when sexually transmitted infections are at an all-time high, they've fallen out of the national conversation, he said. There's an urgent need to reverse the trend of increasing STIs, especially in the wake of the COVID-19 pandemic, which has affected many STI prevention services. Dr. Raul Romaguera, acting director for CDC's Division of STD Prevention, says prevention is key. There are significant human and financial costs associated with these infections, and we know from other studies that cuts in STI prevention efforts result in higher costs down the road. Preventing STIs could save billions in medical costs, but more importantly, prevention would improve the health and lives of millions of people. Y'all, go get tested. You want to get a good Valentine's Day present for your significant other? It don't matter how long you've been together. Don't matter. Go get it. Go get a fresh test. Go bring back that clean as a whistle test. You know what I'm saying? That's the Valentine's present that you really want. You know what I mean? So I'm just saying. Go get tested. There's a lot of ways. There's a lot of community resources. There are ways to get tested that if you don't have the money for it, right? There are definitely services out there and clinics out there that will help you out. So just make sure you go get tested, y'all. It's super crucial. And now on to the racism crisis. So we have a series of studies from the Kaiser Family Foundation about...
I found this on the web.
Oh, Siri, no one was talking to you. Come on. So it's funny because I said we found a series of studies from the Kaiser Family Foundation website about how Black Americans have been disproportionately affected by HIV and AIDS since the epidemic's beginning, and this has only deepened over time, y'all. So let's get into this study real quick. See, although they represent only 12% of the U.S. population, Black folks account for a much larger share of HIV diagnoses, 43%. People estimated to be living with HIV disease, 42%, and deaths among people with HIV, 44%, than any other racial ethnic group in the U.S. A number of challenges contribute to the epidemic among Black folks, including poverty, lack of access to healthcare, higher rates of some sexually transmitted infections, smaller sexual networks, lack of awareness of HIV status, and stigma. Today, there are more than 1.1 million people living with HIV/AIDS in the U.S., including 476,000 who are Black. The rate of new HIV diagnoses per 100,000 among Black adults and adolescents, that's 47.5, was 8 times that of whites and more than twice that of Latinos in 2018. The latest data indicate declines in both the number and rate of annual new diagnoses among the Black community in recent years, including among women. Black women are most likely to have been infected through heterosexual transmission, the most common transmission route for women overall. Black women are less likely to have been infected through injection drug use than white women. Women and young people. Although new HIV diagnoses continue to occur disproportionately among Black women, data shows a 43% decrease in new diagnoses for Black women between 2008 and 2018. In 2016, more than half of gay and bisexual teens and young adults with HIV were Black. According to a national survey of young adults ages 18 to 30, about 3 times as many Blacks as whites say HIV today is a very serious concern for people they know. Almost twice as many Black young adults say they know someone who is living with or has died of HIV/AIDS compared to white folks. Young Black, gay, and bisexual men are particularly affected, with those ages 13 to 24 representing over half of new HIV diagnoses among all gay and bisexual men in that group. In addition, newly diagnosed Black, gay, and bisexual men are younger than their white counterparts, with those ages 13 to 24 accounting for 34% of new HIV diagnoses among Black, gay, and bisexual men in 2018, compared to 16% among whites. Annual new infections among Black, gay, and bisexual men have remained stable in recent years, as have new infections among gay and bisexual men overall. We're going to keep talking about this, y'all. We're going to keep talking about this racism as a public health crisis that it is. That's why California deemed it that way last year. So some stark numbers right there for us, but also some good news that things are on a decrease, so we're going to be thankful for that, and we're going to keep doing our part. Now for my favorite segment of this show, because behind every great man is a great woman, and in my case it's a whole team of great women led by the one and only Netta Ashtari, and Netta found this. So, it's about to be Valentine's Day. So some of us are like, really hyped because we got partners. Some of us don't have partners and been feeling that loneliness. We've been talking a lot about the loneliness throughout this episode. This is how loneliness affects you. And Netta found this. Yeah, y'all. So whatever you gotta do, there are a lot of methods of technology that we can use to keep in touch with each other. I like Marco Polo myself. And just do what you can. Make sure you're reaching out to folks. If you are, if you got your little pod together, maybe reach out to some of us people who living on their own. You know what I mean? Reach out to your friends. Let them know that they are thought about and cared for. And we're just gonna keep getting through all of this together. You know what I mean? Man, I know it definitely means the world to me whenever I get reached out to, because I'm one of those people who's been quarantined by himself with his dog for the last 11 months now. So, that'll break your heart. That'll break your heart. And speaking of broken hearts, did you know that you can die from a broken heart? An actual broken heart? It is called cardiomyopathy, and it is the subject for this week's It's Called Science.
My heart was pounding out of my chest, like I couldn't breathe. I would have pain in my jaw, just like in my jaw and up like here. I felt really anxious and scared.
And then, within 15 minutes, all of that would go away.
And usually they would say it's just anxiety, or you're having a panic attack or something like that.
What actually happened to 35-year-old Crystal Anderson was real. Her heart was breaking, literally.
I wouldn't call it common, but I wouldn't call it rare.
Dr. Cynthia Bateman sees some men, but mostly women with stress cardiomyopathy or broken heart syndrome. These are women in their 20s, up into their 80s. They are not having a heart attack, which would involve a blocked artery. This damage is to the heart muscle in the left ventricle.
This whole area of the heart isn't moving. You notice that?
Yeah.
See how it's not moving at all? I mean, it just looks like it's dead. Okay? Very different than this part, which is hyperdynamic. So there is something that happens that shocks the heart.
It's stress. There are some women who have stressors that are extreme and lingering and build up.
I think there's a lot that women sort of internalize and don't show.
More often, it's a stressful incident, the death of a spouse, a bankruptcy, a break-in, that produces an excessive amount of adrenaline that shocks the heart. But the damage is not permanent.
You get them on the right medicines, and within even 48 hours, sometimes you'll see that heart muscle get back to normal. Some people will take a couple more days.
Crystal is doing better. She's walking up to 5 miles a day, can identify and react better to her stressors, like the anniversary of her grandmother's death. Medication blocks the adrenaline response to stress, so her heart muscle stays protected.
It's healed completely, 100%. Yeah.
Wow. Where am I? There I am. There I am. So cardiomyopathy. And it happens in women more than it does to us, fellas. Why do we think this is? I'm just saying, maybe bigger hearts. All right, so we are going to get into it right now. We are incredibly blessed. It is Valentine's Day. It's a Valentine's Day show. So we are going to have a baby making expert, the likes of which do not exist in this dimension or probably any other. Y'all, she is the Michael Jordan of midwifery. Y'all give it up for Loads Joseph.
Hello.
Well, hi. How are you? How has quarantine been?
Quarantine has been a thing. However, when I sit back and reflect on quarantine, I'm like, wow, I got married. I'm pregnant. My spouse and I are doing okay. No like romantic getaways, no chasing flights, but there's just a sense of being grounded that I'm very, yeah, I guess I'm very appreciative of. But I could, I could spend some time on the beach though. I'm not gonna lie.
Right. Well, and congratulations.
Thank
So
you very
this makes
much.
you were already the Michael Jordan of midwifery, as I have had it explained to me. So now the fact that you are pregnant with your own, as well as helping you're the baby making expert that we needed on the show tonight. I'm so excited to have you here. So you are like I said, the Michael Jordan of midwifery. So for those who don't know, what does a midwife do?
That's a great question. And I spend almost every other clinic day going through this. So it's not something that people realize. So I'm a midwife, and I say that I'm a midwife not to give a vague description because there are many pathways to midwifery. And so I'm a full scope midwife, which means that I spend a portion of my time in the hospital attending deliveries, supporting pregnant people when they're about to have their babies. But I also spend a significant amount of time in clinic dealing with like issues with pregnant people and people that aren't pregnant. And so people who want to get pregnant, people who no longer want to stay pregnant, people who have like infections, anything from sexually transmitted infections to like vaginitis, vaginosis, or quite honestly, because we're in a rural area, people just come to us to see us. They're like, oh, I thought you were my doctor. I come and see you every year. So midwives are really a great entry to care because people remember us once they've had their baby. They come back and see us postpartum. But then if there's an issue in their life, they're like, oh, okay, I could just go to the midwife, who many people think we are medical doctors, but we're not. So, you know, I think the midwifery model of care is one that really centers the patient. And so patients really appreciate seeing a midwife. And even though I was trained as a certified nurse midwife, the reason I identify as a midwife is because my pathway isn't as important as the role that I provide to the community and the work that I'm doing.
I love that. So how have you seen COVID-19 affect what would be your regular work, and how has it changed the scope of your work in the last year?
So definitely, COVID has changed the workflow in terms of expectations from organization, but also expectation from patients. Patients expect us to be safe and diligent, but to a level where sometimes it's like lead by example, but some of our patients aren't doing that themselves. So sometimes that's kind of hard. Or I've had patients who are like, gosh, you're beating me up like, a dead horse, like, because it's part of my spiel: hand washing, social distancing, mask wearing. Now there's a new variant. I even recommend double masking. I have on an N95 and a mask and a shield. And so then sometimes a patient will test positive in the hospital and they're like, Miss Loads, oh my goodness, I just thought you were, being too cautious. Or we have patients who end up having like real emergencies or have lost significant members of their families. So I think for them, they realize it, they see it, they understand it's not a game, and they understand it's like we're up against something that a whole community isn't helping control. So it almost feels at times selfish. So I think from an organization perspective, which, as I said, I work for a federally qualified health center in southwestern Georgia. I think there are some leaders that are just like, I want things to return back to normal. And I wholeheartedly disagree with that. I think that we're in a pandemic, and it's so selfish to say, I'm just going to pray on it. I'm just going to wait for things to come back to normal. Everybody wants that. Everybody wants that, but the best things we have, the best tools we have are for us to not gather. And that's hard for everyone. That's just not hard for, Southerners, Northerners. And so I think, unfortunately, there was a lot of, obviously politics that got in the way of the pandemic and progress. So again, I think that patients expect us to lead by example. And I think organizations expect providers to just keep on seeing patients, which is hard because we are all so tired. Like I'm tired, not just as a pregnant person, but as a provider. I think my spouse and I spoke about it. I mean, it's one thing to not go on vacation, but I was like, I hadn't taken a day off in maybe 8 or 9 months. And I was like, wait, I need a day off. And I took a day off for my birthday. That was at like the end of last year. But that's not the norm. You do not just work and work and work and work and expect excellence. It comes, I think, with a cost.
And we should all be buying all of our nurses, midwives, doulas, anybody that work in the medical field. Like, you need to be buying some dinner, some coffee, some desserts, send some snacks over. You know what I mean? Nurses be telling me that they want healthy snacks. I'm saying maybe throw a little bit of cake in there too. You know what I mean? Man, what y'all do, and thank you for just going as hard as y'all are going right now, just across the whole medical field. So I'm curious, how early in life do you realize that, like, being a midwife, this is my calling, this is what I'm supposed to do, and what draws you into that work? How do you get into this line of work?
Yeah, I think, I'm the child of immigrants, so definitely it's something that's looked down upon. They were like, you need to be a doctor. Mm-hmm. So I think once you know yourself, the way I got introduced to this is I was doing public health work in Haiti, and I'm Haitian American, and I just realized I always wanted to hang out on the labor ward. I love being around children and moms and, parents. And then I started meeting midwives, and they're like, you're a midwife. And I'm like, no, I'm not. And they're like, no, it walks like it's like, it walks like a duck, smells like a duck, quacks like a duck. And I was like, I don't know what you guys are talking about. I am not a clinician. And they were like, yeah, you are. And then I started looking up midwifery, and I was like, So I became a doula once I left development work. And I realized I was at the wrong side of the table. And that's the best way to put it. I was in the hospital, and I was like, I'm supposed to be over there. That was like the nagging sense. And I love supporting birthing people, but I also knew my voice could be used in a different way. And I can advocate more as a provider. And, I think it's really hard work. I think as a Black person, there is definitely like an ancestral pull. Like for me, there's no way I could be doing this work without thinking of ancestors and people before me and understanding how important this work is, and how privileged I am to do this work. But I think that for the most part now, I always had a program director. She would say, if you watch The Business of Being Born and you want to be a midwife, you are in the wrong field. And I'd be like, dang, calm down. But what I would say is it's not for the faint of heart. It's not pretty. We're undervalued. We're underpaid. It's not like glorious. And so, but that connection is just priceless, you know, knowing that you're working on something much, much larger. You're bringing communities, their foundation. And again, because midwives do so much, you know, there's the advocacy piece, there's the research piece, there's the teaching piece. There are all these other components. It's really powerful. So I'm very, very, very lucky that you know, it's almost like the universe was like, okay, you're ready to be a midwife now. Because I wouldn't have been able to do this in my 20s. As you can tell, I have some gray hair. So I would not have been able to do this in my 20s.
So basically what you're saying is, much like Bubba Sparks, you didn't choose this, it chose you. God, I'm glad you got that. I was like, this is a 50-50. She's either going to walk with this or not.
Get it. And Bubba Sparks is from LaGrange, Georgia.
Ah.
Atlanta. Yeah. Look, my spouse makes fun of me talking about how Southern I am. I have a grill.
Yes. Yes. This is the midwife I want delivering my child.
So without the mask, you will never be able to see my bottom grill. Like, ugh.
Do we do gold? Do we do platinum? These are the questions that people really want to know.
It is a gold. And I wish now that I had gone a little rose gold. So, you know, c'est la vie. Yeah.
That's awesome. I also have gold bottoms. I feel like maybe we should have coordinated before we did this interview. So you mentioned it in kind of the last answer, and something I've really noticed, more and more women, especially women of color, utilize midwives, utilizing doulas. You know, I don't think up until 3 or 4 years ago that I had even heard the word doula, and now I hear it pretty much anytime any one of the homegirls is pregnant. So what do you think this rise in popularity of midwives and doulas is?
I think birthing people want control over their bodies and choices, and they want to be supported. The medical model is not one that will support and empower people. It's you're a number. And I was telling someone that at some point, I hope I can write about it, but you're almost penalized for being normal. Right now, if you are not a high acuity patient, you are not getting these long visits. It's our patients that are super complex, just things could happen at the drop of the dime. Those are the patients that get these long prenatal care appointments. Other patients, not really. And it's like, oh, am I being penalized because I'm in the window of normal? So I think that people are like, wait, there's a midwife that'll listen to me, that I'll learn from, and then doulas handle the non-clinical part. And so I think it's this excellent complement for what support looks like. And birthing people need support. People need support throughout transitions and milestones. And I think we just forget that in the medical model. It's like, okay, let's see how many we can see, we're gonna bill, make that money, and that's it. And so I think, birthing people have always known midwives. Midwives have been here since the beginning of time, right? We don't have any communities documented where birthing people birthed alone. And we've always had something like a doula, and no matter what language, there was always someone who supported you. So why would we not want that? Why would we want to be alone, scared, with someone who comes in at the last minute and goes, gowns up and goes, okay, I'm ready to catch the baby, boom. Anybody could do that. But midwifery is so much more than that.
Absolutely. And especially for women of color, Black women especially, like there's a lot of evidence going around as far as how pregnant Black women are treated in the system. You made a really poignant post on your IG last summer, referencing an article by Maya Feller that said, I am a Black midwife of childbearing age who knows that no amount of degrees can protect me. First off, as a poet, I just want to say bars. Like that, the way that you put that is so powerful. What do you consider the biggest threats or challenges facing Black women during pregnancy and delivery?
First and foremost, racism, because it's just there. Second is fear. I mean, every day you're bombarded with people telling you all these negative things like stillbirth, demise, the maternal mortality rate, preeclampsia. This person ended up having an emergency C-section. And I think it's almost like you forget how powerful you are. Like my acupuncturist, who is a white woman, total hippie, she was like, when I was, pregnant, it almost felt like I had a surge in my second and third trimester. And I remembered that going into my pregnancy, it just kind of like made an impression. I was like, oh, wow, I'm going to be like this strong rocket, and just be this powerful, dynamic force. And I think that Black, Indigenous, Latinx women have to remember that. We have to remember we have so much power that, it scares people when we stand for what we know is right. When we keep on coming to emergency room and we say, something is wrong, like, listen to me. The biggest thing is that sometimes people, are reactive. Like some people come into the emergency room several times, come to labor and delivery, and they're so, I put in quotes, really nice and passive, and they get dismissed. Then you get somebody who yells in your face, curses you the fuck out. You run all those tests and you find out, oh yeah, she right, something's wrong. And it's like, why did I have to do all that? Why didn't you just listen to me? And so I think it's almost coming up. It's like a grand boxing event, right? And it's like, that's opposite of what you want when you're about to have a baby. That's not the mindset that you should be in, that this is going to be a fight. It should be that everyone around me is here to protect me and support me. And so, I think even my spouse personally has to be like, if they're not on your side, cut them off. Like, this is a time where you need cheerleaders more than you ever realized. And so I think people have to understand that. And also the stresses of life. We are not in a childbearing society, friendly society. I think that so many jobs, I have so many patients who have to write letters. Like, I need to write a doctor's note to excuse them because they came to prenatal care, or else they're not going to get paid. They also need a note saying that, they have to go and pick up these prescriptions, or they're going to need a referral. I write letters for people's partners who are like, can you write a letter saying that, I was actually at the birth, I might lose my job. Can you write a letter saying I can go to the bathroom more often because they're on the factory line, chicken plants and other factories, and manufacturing is big down here. So I think we have to understand our society is not one, if you're privileged and you can work remotely, that is beautiful and great, but if you don't have that, it's stress, and it's also something called weathering. It's just like the accumulation of all of these stressors, and you're just carrying them. You're just carrying them and carrying them and carrying them for 30 something weeks, 40 something weeks, and eventually it's like, this is too much. This is too much.
Again, you're a superhero. Thank you for doing all that you do. Now we're coming up on Valentine's Day, doing a show with a lot of reproductive health stuff.
Yes.
What is something that not enough people know about reproductive health?
Oh, it involves everybody. I think nobody is protected. I think sometimes we hear reproductive health and we're like, go ladies. And it's like, no, 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 no. You know, everybody is involved.
Hold on. We're just going to re-emphasize that point for all the fellas over here.
Yes.
It's not specifically for the ladies. This involves you too. All right.
It involves our non-binary folks. It involves our trans folks.
Absolutely.
A lot of folks, I just want to like, you know, who think like, oh, I'm on hormones, I can't get pregnant. There are people who think like, oh, I can't get an STI because somehow my partner and I are queer and female bodied. Like there are just a lot of things. And then also when we think of reproductive health, we're so focused sometimes on genitalia. And it's so much more. It's about pleasure. You know, it's about Valentine's Day. I mean, shoot, people can run me some chocolate if they don't have anybody else. But you know, you have the right to experience pleasure as well. So as much as I like joke with my patients, I'll be like, you need to see the papers. And the papers are, you know, your partner's STIs. I also think that people have the right, if they want to, as adults, to engage in risk. And that's something that's really hard to say. Like, you have the right to have sex. And some people are going to say, well, this is the way I like having sex. And so how do we move around that? And how do we move around that safely without shaming folks, without just saying, well, because you were out there, that's how you got that. That's on you. It's like, there's a more sophisticated way to support folks. So I think it's just something that everyone's involved in. It's not just one particular group's issue. It's everybody's issue.
So any specific advice for the lovers out there as we approach Valentine's Day from our baby making expert?
Have fun. Experience pleasure. Pleasure doesn't always result in an orgasm, you know, so sometimes people have that totally linked, like you must, you know, just climax and just explore, you know, it's also about love. I'm distilling this commercial holiday, but it is also about, you know, love and self-love. So, you know, don't just, you know, be swiping, trying to find that boo and that person to hook up with. You know, you might need to go bust a nut, masturbate, take a bath, read, you know, participate in all the kind of self-care. And also it's okay to have like, you know, friends Valentine's Day. It isn't just this like romantic kind of love. There are also other kinds of loves that we need that sustain us.
Deep. All right, so I got one more question for you, which is a question I ask everybody who comes on this show. I myself am an expert joy hunter. What's the source of your joy these days?
Oh, definitely my spouse, without a doubt. My spouse. We laugh, laughing, being petty. Ooh, can we talk about that Super Bowl? Like, I know I should just get rid of it, but like, exactly. So like this more, I had a dream about this Super Bowl. I was not even invested in these teams, right? So then my spouse is like, oh my gosh, like, why can't you let this go? And, you know, I was like, you're right. So sometimes you just need somebody who like can deal with your crazy, you know?
What's funny is someone hit me right before we did this interview and was like, are you going to talk about the Super Bowl on tonight's show? I was like, y'all know that I was sitting there irritated. Like, how many people are in that stadium right now? The Super Spreader Bowl? All right. That's okay.
There are so many things, yes. In addition to like, okay, Mahomes didn't win or the Chiefs didn't win, but okay, we'll let it go. I don't want my blood pressure to go up.
Well, thank you so much for number one, just for being you.
Oh, thank you.
Number two, just for being here.
Mhm.
And know that you've got a team of cheerleaders over here on the West Coast for everything that you're doing. Just a real honor and a real pleasure. Any parting advice for people that you want to leave?
Yeah, support your Black, Brown, and Indigenous midwives. And I think that's really important because we currently only make up 6% of certified nurse midwives. There are definitely more, like upwards of like 10% that are certified professional midwives. But support your midwives, support your midwives. This work is critical, it is needed. And at the end of the day, we love you all. So we just want like healthy birthing people who find themselves and find their truth and feel like they're supported. That's the bottom line. And it's a privilege to do this work. I'm still excited that I'm doing this work. And I appreciate the work that you are doing. And if you have any questions, concerns, comments, please feel free to ask. I can be found at the Haitian Midwife on Instagram. And before I leave, one organization that I absolutely love, 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 love is the Foundation for the Advancement of Haitian Midwives. Haitian led. It is not just a group trying to take over midwifery or just promoting going to catch babies. They are doing the groundwork, the hard work of supporting Haitian midwives and building up classes and thinking about a pipeline of Haitian midwives for urban and rural areas. And that's all I got to say.
We love some pipeline building around here as long as it's the right kind of pipeline.
Exactly.
We're all about that over here. Well, thank you so much for joining us, and we will be in touch. You got to come back on the show. We got to have the grilled up interview.
Yes, 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 we should.
Y'all, this brings us to the end of another amazing episode of Masked Up, a community health live stream. Make sure you tune in every Monday night at 8:08. We've got all-stars from every area of the medical field that stop by, have conversations with us, and you can always pop into the comments, ask those questions. You can also always contact us and hit us up at the Masked Up Livestream at gmail.com. Right here. Go right there. Send us an email. Give me something to do during the week. Man, appreciate everybody who shared this. Appreciate everyone who's been a part of this and making it happen. Special shout out to our partners at Protect Us. And that's it, y'all. I'm Andrew Defy. Stay masked up. Stay healthy. Love y'all.